Hello again, back with Dr. Harrison at the Harrison Heart, Vein, and Vascular Clinic. Thanks again for joining us.
Thank you.
We just moved rooms because we are doing a live screening of what this looks like. This is an ultrasound screening. They are free for the next 2 weeks. You do have to call to set up an appointment, but we really just want to show how simple this is and how easy it is to have the screening done. The procedure is actually simple too, the treatment is, but this part is just very simple, but so important because it kind of gives you a map so that you know what you're looking at and know what you're doing.
Exactly right. So this is Sarah, and Sarah has had some problems with heaviness in her legs. She's had some swelling in her legs, and there's one area on one of her legs that's painful to touch. And if you look at it closely, and we won't be able to show it here with this camera, but she's actually got a little reticular vein there. A reticular vein is a little tiny vein that has increased pressure in it. And it usually suggests that there's an underlying problem, whether there's higher pressure in the bigger veins that you really can't see on the outside. So what we're going to do today is we're going to look, this is our vein screening that we're talking about. This is the free vein screening to come in and get. We're going to, John is our vascular technician. I've already talked about John and his credentials. We're going to screen here and look to see what this vein looks like. And we're going to look mostly to see if the valve in these veins are working or not. If the valves aren't working, then blood stays downhill because of gravity, and it causes pressure, and pressure causes spider veins, and it causes reticular veins and varicose veins, heaviness, swelling, all the issues that we've been talking about. So let's go ahead and get started.
Okay.
Sarah, do you have anything?
No,
You're comfortable?
Pretty much covered it.
Okay.
Thank you
All
for
right.
being here and doing this. John, thank you as well. Typically, I will say the lights would normally be dim, but because of the live Facebook event that we're doing right now, we're leaving the lights on. But go ahead and tell us
Can
kinda
you
how
see
this
the
is
screen?
working.
Okay, good. So John, show us.
So we're
what
in the
looking
greatest
at.
saphenous vein right here.
And that vein drains the skin and the subcutaneous tissue. It's just under the skin. Let me do that.
Yes, please.
And what we're checking for here is reflux.
Reflux. What do you mean by that?
Okay, reflux is where a valve in the vein should snap closed in a half second.
Huh.
If it stays open, it means that blood is pooling downstream, causing high pressure.
How interesting.
Ready again?
So what did you see there?
So we're getting a little blood flow.
And this is a normal ultrasound. If you've been pregnant or anything like that, probably pretty used to an ultrasound, very pain-free. Are you having any pain?
No.
No, excellent.
That's fine.
So,
Augmentation.
Okay.
Okay. So far so good. No reflux is showing right here.
okay. Where it really does give you a zoomed-in look.
Yeah, you
at
can
what's
really
going
see
on
that
inside.
vein.
Press. No reflux here. Everything's good.
And so you kind of can go through and navigate all those problem areas or any place where there's pain.
Yes, and we not only look at the greater saphenous vein, but we look for any accessory veins that may be branching off.
So
up higher.
here's, talking about that right there, Doc, here's the main greatest saphenous, and it's branching off, it's coming right through the fascia compartment, right here.
Mm-hmm.
And now that one's going toward the skin. You can see
Goes to the
there.
skin. So she has two branches coming off right here. One here, and one here.
Is that normal or is that considered an issue?
That is creating pressure in her leg.
Oh,
So when there's so much pressure, it branches off. Here's one, that's the main greater saphenous vein. And there's so much pressure in her leg that it's splitting, it's bifurcating, and causing other areas for her veins to move to because of the pressure in her body.
So we could actually see it kind of part there.
Yes. And if I follow this all the way down, we're going to see another split right here.
Yep.
Okay? That's how much pressure she has in her leg. It could
My
be genetic
goodness.
or it could be professional. If a person is standing on concrete all day, chefs, retail workers, doctors, nurses.
Nurse.
Nurse, there you go. And you said that you'd have some pain for a while. I've been meaning to come in, but you know, life gets in the way. So this kind of worked out well.
It did.
So here they are meeting again
Yep.
and splitting.
How interesting. Look at that.
And you can see how dilated it gets.
Yeah, it's much bigger now than even up top. And typically it would be much smaller down here because blood is coming this direction. It's coming from the feet this direction. So it should be small down here and lots of them, and then it gets into the larger vein up here, where in this case it's dilated because of increased pressure.
So what we have here, this is called a perforated vein. This is a vein that comes from the deep system into the superficial system right here. You can
It goes
see
right into
right
the
here.
Tibial.
Okay.
That's a connector vein. Those connector veins are good to have. It's not that they're bad. They're part of the normal anatomy.
Okay.
However, if the valve is not good, then blood flows freely between the two systems, the deep and the superficial system, and that can increase pressure too.
Wow. You were saying how it really is the valve, and I know you have
It is, and there's a
poster
picture
back
exactly right here.
the healthy versus the disease. It really
Right.
is the opening, that valve, that makes the world of difference.
Right. This valve should snap closed within a half second. In some patients, it'll stay open for up to 4 or 5 seconds. Well, that allows a tremendous amount of blood to pool downstream, causing high pressure.
And you know, we hear 1 second, 4 or 5 seconds, but what a huge difference it makes on your legs.
Huge
And the pain.
difference. And the pain is right.
Wow. So when you see something like this, we're looking at pressure.
Yeah,
What would the treatment be that you would suggest?
yeah, we're about finished, John. We're gonna show this.
Yep.
There's the reflux.
There's
See the
reflux there.
No,
See reflux below the baseline?
Oh, wow.
That's blood
you-
that's continuing on after that valve should have snapped closed.
Similar to what
So
we
I'll
think of
show you.
reflex
Yeah.
in our
In your esophagus, right.
Yeah.
Okay, there we go.
There you go.
So you've got,
Wow.
how
Flow
many,
below the
how many
baseline right here.
seconds there, John? Is that about 2.5 seconds?
That's that reflex that we're talking about. that kind
2.1
of-
seconds.
2.1
2.1 seconds. So a normal is a half second. She's got 2.1 seconds. So that's a lot of blood that can then go the wrong direction.
Okay.
And that's what we want to correct. So what we'll
Oh,
do
my.
is we'll take a little tiny hair-like needle,
Okay.
numb it up right here, and take another needle and go into that vein. We do that under ultrasound, and then we'll squirt foam in there. And we'll lift her leg up so that blood's running this direction, the foam runs this direction. We hold pressure up here, hold pressure down here, put the foam in, 20 minutes, we're done. Her legs are wrapped and she's gone.
Wow.
And this shows an accessory vein right here,
Yeah,
coming off the junction. One goes to the main. And there's the accessory vein, which also splits because of the pressure.
yeah.
And
So
how
some
bad?
people have accessory veins
Uh-huh.
too, that we look for everything that's abnormal. An accessory vein, instead of having just one vein that goes all the way down, maybe for any number of reasons, she may have an accessory vein that is also dilated and a problem. So now we have to treat both accessory and the greater saphenous vein with foam to get rid of the entire problem. And so that's why I like to think of us as being such a complete center.
Right.
Because we look for everything and try to treat it all, so that the end result is a happy patient.
Absolutely. And again, now we are doing free screenings for the next 2 weeks. You have to call and get an appointment. Do you have that number by
That's
chance?
good, John.
If not, we can take the phone number off.
Yes, the number is, area code's 501,
Okay.
we're here in Benton, 398-9195.
Excellent, Annie, and this is Dr. Harrison, and we are at the Harrison Heart, Vein, and Vascular Clinic. We wanted to show you this because it is non-invasive. Sarah, any pain, any discomfort? No.
It's fine.
So it's about as easy as you can get, but it's also not just looking at the leg and seeing the surface of the skin and saying what is or isn't there. So important to get the ultrasound. so easy to really do. It's just that first step that you have to take to get in here when you say, oh, my legs feel heavy, I have a lot of leg pain. We're talking about something that could really change your quality of life.
It does, and I can say almost without doubt that every single patient that has come in with problems that we fixed is very, very happy. They're very happy. You know, we have built our practice over the years on outcomes. Outcomes are what's incredibly important to us. You've got to have good results with what you do. And so far, we have a 98% cure on patients that have problems, and even the healing of venous ulcers. Our cure rate is 98%.
That's incredible.
It is.
It really
We're
is.
very proud of that fact and very happy to help out.
As you should be. It really is all about quality of life. So pick up the phone, make that appointment. If you do have follow-up questions that we may not have gotten to, you can comment on this post as well. Dr. Harrison, Sarah, John, thank you very much for
Thank
being
you.
with us
Thanks,
today.
Christina.
We appreciate it, and
Thank
we
you, Sarah.
hope to see you soon here.